we still have to pay for prescription drugs. You want to benefit a family, reduce the cost of the prescription drugs they have to pay. In America, we pay the highest price for prescription drugs in the world, of any developed nation in the world, about 2 to 3 times what other countries pay. Let me give you I can give you hundreds of examples. Let me give you one. One anti-cancer drug to treat leukemia and lymphoma that costs $14,000 a month in the United States. That same exact drug by the same drug company, that drug sold in France costs $6,000. $6,000. Those who live on the Canadian border, you cross the border, you can buy the same drug for a hell of a lot less than you can buy in the United States. Same manufacturer. Or take insulin. The cost of drug companies to provide insulin, a vial of insulin, costs less than $10 to make. But there are many families, like families I met last week in Culpeper, Virginia, paying $300 per vial for medicine they need every single day for type 1 diabetes. If they have good health care coverage, this family does, but they still have to pay $5,600 for prescriptions before their insurance kicks in. Think about that. 200,000 American children with type 1 diabetes. Think about being one of those parents. You don't have insurance, but you know your child to live needs that insulin. How do you look that child in the eye when you don't have the income or you don't have the insurance? What do? Not only you worry your child may die, but you're stripped of your dignity. You're stripped of your sense of who you are, not being able to afford that child's needs. Look, we can cap the cost of insulin to $35 a month. Drug companies will still make money. Let me digress just for a moment. I started the Cancer Moonshot, which I worked very hard on in the administration I served in last. And I held conferences all over the country with literally thousands of people, and at the same time on doing it virtually. And after one of them, I got the 12 largest drug companies in one room, and I said, if you found a cure for a particular cancer, and I named a cancer, I said, what amount of money do you think you should be able to charge for that drug? They said, whatever the market will bear. And I said, well, many places like Germany, you can get and make sure you make a profit that's 20 to 30%, even 40% more than your total investment. But once they set the price, that's the only price you can pay to sell that drug. You still make 30, 40% profit after all your expenses you demonstrate. And the other provision is you can't increase the price of that drug beyond the cost of inflation unless you've done additional work on the drug to improve it. Think about where we're going. We're on the verge, thank God, of some significant breakthroughs in healthcare. But should it be based upon what you can afford to pay? If Congress acts, we could take care of things with a stroke of a pen tomorrow. We have a generation of so-called sandwich generation. Many of you are part of it. Trying to take care of your children while take care of your aging mom or dad. We can help make it work. Care for our elderly parents and have someone install a handrail in the shower, make sure they have steps that they can get up and down. Someone can pick up the prescriptions while you're working and allow them to continue to live in the dignity of their home. But guess what? That saves a hell of a lot of money. Because the cost of that, and by the way, that's available under Medicare now, except 880,000 people can't get into the program yet. It's a lot cheaper to have mom and dad live at home with the minimal expense than have the public pick up the cost of health care, of housing for the elderly. We can do that and still save money. So when they put their heads in the pillow at night, they can have peace of mind. I'm going to work like the devil to bring gas prices down.